Hey Tupelo, Dr. Carver back with another video. We've got a really good topic for you today. It's carpal tunnel syndrome. It causes pain and numbness in the hand and the wrist, and it's something we see a lot of, so I thought I'd share a quick video about what it is and how we treat it. So, carpal tunnel syndrome is irritation and inflammation of the soft tissue in the wrist. The carpal tunnel itself is a structure that houses the tendons of the hand as well as the median nerve, which supplies the thumb and the first couple of fingers. So when that carpal tunnel has inflammation and becomes too small, you get the symptoms. Now these symptoms are usually tingling and numbness in the thumb, the palm, or the first few fingers. A lot of people say this pain gets worse during the night or in the morning, or especially with activity. It can make a lot of people want to shake out their hand to kind of help with those symptoms. It also causes aching pain in the wrist and hand, and sometimes it can even shoot up into the forearm. Also, weakness in the hands and fingers is pretty common. These people say they might have trouble gripping objects or fine movements like writing or typing. Now, the main thing that causes carpal tunnel syndrome is overuse. So, cell phones, people who work with their hands, typing is a really big one. These small repetitive stresses cause the inflammation, the nerve and ligament compression, and ultimately the pain. Other factors like injuries and anatomical variants can play into it, but overuse is really the big cause. Okay, so what can be done to fix it? First of all, because carpal tunnel symptoms look almost exactly like the symptoms of a nerve condition in the neck, we like to start by taking a close look at the neck to make sure you don't have any indicators of a disc bulge or impingement of the nerves that supply the wrist and hand. So we might do some orthopedic testing or maybe even some imaging to rule that out. Once we know we are dealing with carpal tunnel syndrome, we usually start with a three-tiered plan. The first thing we do is make sure the joints in the hand and the wrist are moving and functioning the best they can. We do this with very simple and gentle adjustments to the area. This is going to make sure the range of motion in your hands is the best it can be. The next thing we do is begin to loosen up the soft tissue in the area. This is done with some really simple stretches and exercises designed to help take the pressure off that carpal tunnel and all the structures that run through it. You won't need a gym membership or any special equipment. We'll show you how to do them here and let you do them at home, and we'll just check up on them periodically. But the main treatment we use for carpal tunnel syndrome is our Class 4 laser. We know it's the treatment of choice for inflammation, so it works really well and really fast. Typically, a handful of treatments gets our patients full resolution. It penetrates really deep into the tissue, reduces the inflammation, and stimulates the healing process. You can go to our Facebook page and our YouTube channel to check out some of our other videos to learn a little bit more about how it works so well. I'll also leave a little bit of research in the description for you. You'll see it's a really, really great option for carpal tunnel. So, with any nerve compressing disorder, you want to catch it quickly so you can avoid the risk of long-term nerve damage. So, give us a call or reach out online right away if this sounds like you or someone you know. We'd be happy to take a look at it and let you know if we can help. If you're out there watching, give us a thumbs up, share this video with anyone who you think needs it. Have a great day. God bless.